Welcome. Week 3, 8 on the dot. We'll get started. I see we got some questions flowing in here in real time. The deadlift, really cool to see some folks rip some heavy weight. Some folks share some stories of back pain, whether being afraid of the deadlift, using the deadlift to get over back pain, and kind of everything in between. This is the lift probably of the course that we think is the most important. Like, this is where you make your bread and butter. This is a lift that understanding this lift can help everybody from your older adults who need to lift stuff off the ground better and carry the laundry basket better, all the way to helping your higher level athletes pull more weight off the ground, get away from back pain, get a stronger back. That's going to increase your performance. I literally had a patient today, higher level Olympic weightlifter, that is terrible at pulling from the floor, has pain pulling from the floor, and was crushing her with just some lightweight isometric deadlifts. So you can have Doris deadlifting all the way up to higher level CrossFitters, Olympic weightlifters, powerlifters. It's really important that you know this lift. So having gone through the lecture material, what questions do you all have here live? I see we've got some on the doc that we'll get to, but I want to hear anything you all have here live.
All right, I'll jump. With patients who are coming in with insurances that are auth based, this is a little bit of a kind of a tangent already, but and let's say you have like a higher level CrossFit athlete, they're coming in, they're now presenting pain-free, their functional scores are lower, and you're like finalizing that plan of care, and you're like right in between that spot. Like, how are you guys you know proving to the insurance company that like rationalizing care at that time?
Yeah, I mean, it's not just about getting rid of pain, right? It's about keeping this person from developing pain in the future. That if we don't fully rehab this person, you can share every piece of literature on recurrence of low back pain, ACL tear, name the joint, name the injury. There's research that shows we don't do a good job of finishing a plan of care and getting people strong enough. And that's why people go on to re-tear their ACL in 3 months or re-tear the other ACL or tear both, right? So all that research is there. There's a lot of it coming in week 6 that we're going to talk about. But saying, like, in my mind, maintenance is even fine. Like, we're keeping this person away from the healthcare system. Like, an MRI is $5,000. A knee replacement is $50,000. Once a week of PT for a crappy insurance like Blue Care Network is $60. Like, what a steal. What a steal to come see me. So I think if you have the physician on board, to keep sending referrals of, this person isn't quite there yet. They're not strong enough yet. Yes, they're out of pain, but that happens in the first couple of visits, right? If you can't fix pain early on, you're not a very good physical therapist. If especially if it's acute and it's mechanical. So to say, like, okay, visit 3, 4, 5, 6, this person's pain free, bye. That's just, it's leaving the ball on the table. Like, there's still a lot to be done to make sure that person is truly strong.
Totally agree. I guess I'll get more specific. Like, you have an ASH form or like a form that you fill out that states like, all they want is they give you like minimal space to fill out subjective strength, etc. And then like you've got an athlete that's deadlifting 400 and they're approaching a pain-free, and they're like, you hop on a peer-to-peer and say like, they're this is why I need them here, these research articles. And they're stating like, well, they're functional, like they're fine to get to and from work.
Yeah, share the stuff from the squat science and the deadlift week. Like, you have reduced injury risk once you can cross a body weight back squat and a double body weight deadlift for a man,
Right.
75% body weight squat, 1.5 times body weight deadlift for a woman. And then you can objectively use stuff like the Berenson Sorensen. Can this person hold 120 seconds, 200 seconds without pain and without fatigue? And if they're not there yet, then you can say this person is not strong enough yet. Yes, they don't have pain, but there's still room to go before we can say this person is fully healed and ready to go back to it.
Just continue.
Especially, if they're not yet deadlifting 405.
Right. Just continue to slap back with research and objective.
Yep.
10-4.
Any questions off of that? That's a kind of a good vein to get into, especially if you're an insurance-based model. with also, I'm not above looking at that patient and saying, if you report that you're 100% better, physical therapy is done, right? So keep that in mind. If their goals have not been met yet, I'm not above that.
I don't lose any sleep at night taking the insurance company.
Same. Okay, if you have more here live, let's hear them, but let's jump into these. I want G to answer this one from Marnie. I'm starting to film my clients' lifts to start looking for faults, which is helpful. Do you still film clients, or do you have a more refined eye that it isn't necessary? Also, which software are you using?
So I'll start with the second question first. Most I've seen used is an app called True Coach. I think it's a paid for app if you try to use their cloud service, but otherwise I think it's still free. Not 100% positive. I bought it a long time ago, so I got kind of grandfathered in. So True Coach is one. There's Alan. There's a Droid one too that works that I don't know about Android one, but
when I had an Android, which if you still have one, quit. I use Dartfish. That's a good alternative on Android.
hey, then there's another one that's called Bar Path, where it kind of actually shows the path of the barbell. And then there's a couple other paid ones, but True Coach is the one I primarily use, and I think it's the only one I've actually really used. So couldn't really speak about the other options you have out there. And as far as filming clients and when do I stop or do I still film? I usually don't film for squat deadlift, especially if it's kind of a newer athlete, because you're going to see those faults a little more obviously. As someone gets a little more refined, gets a little more technical, becomes a little bit more experienced, the subtleties in their movement are going to be a lot harder to find. So that's when you're going to probably take some more time to kind of look at a video analysis, see what could be going on, slow things down a little bit. But if I have to say, I probably use the film analysis a lot more for gymnastics movements where there's a lot more dynamic stuff going on, and especially with Olympic movements where there are multiple components, a lot of stuff going on, and it's a split second between first pull, second pull, and the catch. So there, it's really a lot better to kind of slow things down and kind of see a lot more details in there.
Especially patients that we're trying to get better because it may be a source of pain or something like that. I'm still filming Olympic weightlifting. That's part of it. That's part of the rest timer. You know, we're doing 2 power cleans every 2 minutes, and part of that rest is loading up the barbell a little bit more, but also showing them on the phone what it looks like. Because you'd be amazed how many people have been lifting for a long period of time and have never saw themselves lift. So it can be a game changer for them. We'll get into that a lot more when we get into the clean and the snatch at the end of the course too. I use Coach's Eye. You'll see as we get into gymnastics and Olympic weightlifting, I'm going to pull some videos down of yours and put them through Coach's Eye and show you what you can do with Coach's Eye. And Mitch is literally going to do it tonight with your deadlifts as well.
Tonight?
It's pretty powerful stuff. It's great too. You can do it remote, right? Somebody can send you a raw video. You can break it down and send it back. That's the easiest $100 you'll make is spending 20 or 30 minutes breaking down somebody's clean or snatch remotely.
Another argument for filming even anybody is if someone who says like I can't bend my back that way, or I can't bend my knees that way, filming a movement where they don't feel pain and then showing them look at this position your knee is in. This is the same position you're saying you have pain here right now, and then you can kind of almost have that aha moment of like, oh wow, I really can bend my knee that far. I can let my back bend that far forward. It really works well for the patient who might be a little bit more risk averse or kinesiophobic or scared of like moving a certain way. You get them doing something that's not what they're afraid of specifically, and all of a sudden they see like, oh, I guess I can move that way, and you can use that as a way to kind of help convince someone to do a little more, to be a little more intense or increase speed or things like that as well.
Good question. Mitch, anything to add there? No.
No.
Can I? Oh, sorry.
Go ahead, Brittany.
I actually had a really interesting case that I wanted to share. So I'm treating a high school wrestler who was trying to build like sumo deadlift over the summer, especially going into quarantine, and had a T1 stress fracture and coach couldn't figure out why his deadlift, everything. I examined him. He's pretty good at this point, like 16 weeks after stress fracture. And I'm like, where do you have a video of your lifts from the summer? So even using it retroverted, I mean, he had complete like C7 T1 hinge extension throughout his entire sumo deadlift. So I found that like retroverting or retro using video was super helpful and completely solved that case for me. So just as a good point for others.
T1 stress fracture from deadlift.
Yeah, I'm going to ask permission from him to share it with you guys so you can see, because this would be a great one for you to put through your case. It's insane.
Always tell
And
people,
very good timing with this class also.
yeah. Yeah, everyone's like, what do you think? And like mid-range cervical extension or hardline neutral. And we're a little bit casual on allowing athletes to kind of get into a comfortable neck position. Unless of course we're dealing with like a symptomatic neck patient. But yeah, when we see those athletes, like the high school athletes, that they put like the championship banners on the ceiling, they're like eyes up on their squat and they're like cranking their head. I was like, that's not going to help your squat or your deadlift.
He's like, my coach said I was in perfect form all summer. And I was like, let me see if you have a video of that.
Form's good. You don't even need to watch.
Yeah.
Coach even said.
Coach needs a workshop.
Coach.
That's what I told him. I was like, I would love to talk to your coach and give him some tips on this.
If you're ever worried about people lifting poorly, just go to a high school gym on Saturday, strength conditioning, and you're like, okay, the people at Planet Fitness and CrossFit are doing great. These are the athletes that need help. Okay, not group 12. Josh from group 12 has a bunch of questions here on the deadlift. I want Mitch to take this first one. What are our thoughts on pulling with a mixed grip? Would this not promote a tendency for inconsistencies of posterior chain stability?
Yeah, totally. You get this question every cohort, and I love this question. First of all, for your most symmetrical grip, yes, double overhand or a hook grip. The hook grip is going to be your stronger of the two options. Double overhand without a hook grip is your weakest deadlift grip that you can do. It is by far the weakest. But most symmetrical, right? And if you add the hook grip into it, it becomes a stronger grip, because as the bar is trying to exit, you've got your thumb wrapped and it doesn't have an exit there, right? But the problem with hook gripping your heavy deadlifts is that you've got to have thumbs of steel or have some really good tape on them thumbs to be able to tolerate that. And that's where the mixed grip comes in handy, because now with a mixed grip, you can hang on to heavier loads. As the bar is rolling out of the fingertips in one hand, it's rolling into the palm of the other hand, which allows you to maintain grip on the bar through the sticky point of the deadlift. You have to ask yourself this question. This is always what I'm asking in cohorts. Are you deadlifting to get a stronger grip? Or are you deadlifting to strengthen the posterior chain, the back, the legs, the entire system? Because what I'm deadlifting for is to get the body as strong as possible, to pull the heaviest bars off the ground as possible. And I don't want my fingertips to be the rate limiter for the rest of my body getting stronger. So I'll allow for a mixed grip. And if we're really concerned with developing asymmetries, the simple solution is to every other set, just switch your grip. I go right hand under, then I go left hand under, then I go right hand under, and so on and so forth. And then you don't become the old weightlifter like me, who's only ever deadlifted with my right hand under. And when I go to mixed grip the other way, it feels like shooting a basketball left-handed. It feels really crooked, right? But I'm working on it, right? So all we should have in that mixed grip setup is our normal setup, and we're just internally rotating. We're just like pronating one wrist. We shouldn't even see internal rotation of one shoulder. It shouldn't even happen that far up. It should just be one wrist folded over and then hooking onto the bar and being as balanced and as neutral as we can. You just got to ask yourself, are we deadlifting because of grip strength, or are we deadlifting to get everything else stronger? I'm deadlifting to get everything else stronger, and I don't want my grip to be my rate limiter there. So hook grip or mixed grip for your strongest grip, double overhand for your most symmetrical but weakest grip.
And I dropped some articles for you all on the Google Doc. Just an article saying what Mitch just said. Double overhand is the weakest. Hook grip and mixed grip are the strongest. And then a cool article looking at EMG analysis of those different grips and seeing there's absolutely no change in the back, the posterior chain symmetry-wise with changing grips. The only thing that changed is the supinated hand. The bicep is more active, which is exactly what we'd expect. But nothing else changes in the lat, the spinal erectors, or the posterior chain. Mitch, is cervical extension with the deadlift detrimental? Would that be considered a fault in core stability?
Yeah, yeah, definitely T1 stretch fracture. Yes, if we're looking at the whole midline, the neck is definitely a component to that, right? And so we're looking at like, let's not put this giant kink in the nervous system up here at the cervical spine and really jam it into extension. With that being, like we just talked about with Brittany, like I'm not super rigid on like this chin needs to stay packed in the whole time when deadlifting, because we see a lot of our really elite athletes or elite weightlifters, that chin kind of comes up and looks at the wall in front of them. So a little bit of mid-range extension we're okay with. When it gets to those extreme ranges, like Brittany pointed out, those high school athletes cranking the neck and in max cervical extension, that's where we're going to regulate that and have them bring the chin down. A couple good cues or points of reference that you can tell people, looking like 5 feet out in front of you on the ground, right? Looking straight down between your feet is like too much. Maybe looking at the wall out in front of you is too much extension, but picking a spot on the floor 5 feet out in front of you and maybe locking down on that position the whole time will help. If looking at the wall is too much cervical extension, but we should never be looking up at the ceiling.
Awesome. I appreciate that. Yeah, because it seems like most of us with our lifting faults, especially once we start adding load, it's like we're trying to use our neck to basically pre-prep the posterior chain, just adding too much compression up at the cervical region. It seems like it's a fault that I notice within myself that I struggle to control, especially once I start increasing that load.
And keep it in mind, like, neutrals are ranges, and much like a neutral cervical lordosis, like a neutral lumbar lordosis, a little bit of extension there is probably normal with the anatomy of that bone structure. So again, not being super hard line and seeing it perfectly flat. And then again, like the deadlift is trying to pull us into flexion. So if we can upregulate a little bit of erector activity, I'm okay with that. With the shear forces on board with the deadlift, different than the compressive forces of like a squat. Those shear forces of the deadlift, trying to fight against the flexion forces of those. A little bit of that is okay. That's why you're going to see a lot of your elite weightlifters bringing the neck up just slightly to kind of kick those shoulders back and really fire up the erectors on the posterior side.
Awesome. Appreciate it.
Good question, Josh.
I'll grab this.
The
third
next
one
one
here. Or do you want
Yeah,
to?
I'm going to read it off for you, man, because you're in it, dude. I know Alan pulls with a gigantic rounded back, I think is what the verbiage says. No, it says with a bit of a rounded back, but the position of spinal flexion does not seem to adjust all that much. If I try to on pressing weight until I'm able to prevent that thoracic flexion with the pull, what is seen, or what do you all perceive as good range of allowed spinal mobility with the pull? Okay.
So something to really fundamentally understand, and I hope you all get by the end of this course, is if you wait for somebody to have absolutely perfect mechanics and mobility, you'll never get the chance to load them. Especially think of your older adult, right? Frank's spine has been flexed for 35 years of sitting on his butt. What are the odds that you're going to change that adaptive stiffness in 1 week and be able to load him? 0, right? You need to be comfortable, like, is the spine changing position under load? If so, we're worried about that. But you're going to find, especially with older adults, it can't physically change position. Like you could drive a bulldozer through that thing and it's going to stay flexed. So if it's not changing under position, we're not concerned about it, right? So feel free to load that up. Now you might get heavy enough that you start to see they engage more flexion because now they cannot prevent an increase in flexion. But if the angle of flexion doesn't change, we're okay with that, right? And we can get around that, building it up, elevating the blocks, that sort of thing, lifting the deadlift up, bringing the surface to them to clear up the flexion. But if the flexion isn't changed, we're not too concerned about that. So we need to be introducing load early and often and be happy with optimal over perfect with range of motion. And we need to be looking for, is this symptomatic, right? Can this person pull heavy bars with a little bit of lumbar flexion and be fine? Then I'm less concerned than the person who pulls a bar, the back changes position, and then they have back pain the next day, right? That's somebody that we need to be much more concerned with about their mechanics.
Yeah. Thanks, guys.
Yeah, good question.
A lot of your world's strongest men deadlift, they're kind of like this flexed thoracic spine, but like Alan said, that position just doesn't change the whole time. And I've literally gotten on Alan's back and like pushed on that son of a bitch to try to get it to flatten out more. And like he's like he's like, like making these weird sounds and everything, like trying to get that spine to extend more. It's just not going anywhere. So what he's showing us, although it's in a state of flexion, he's extending it to its limit and locking in that position the whole time. And then, like Alan said, if it starts to change shape, that's where our technical threshold is. And we'll see some videos tonight where we start to see some change in shape. I'll show you one where I start to change shape in my deadlift as my technical threshold. It's like, look, that's when it's starting to break, and that's the load at which it happens at. And that's our cut point, right?
I feel like my spine is extended so hard when I deadlift that the bones might crush each other, but that's obviously not what is happening when we actually look at what's going on.
Shooting out my back.
Amanda has a question. Can you elaborate on the manual technique used in the case study? Unfamiliar with the technique. I took a video of doing it on a patient today. I think this is the one you're talking about, but Amanda, if you're here, mic up, because this was a 27 visit case study. So I used a lot of different manual therapy techniques. So I'm going to pull up this YouTube video and share my screen. So I think this is the technique you're asking about. It's hard to see his leg. So he's in prone. What I'm doing is adding some compression and overpressure through the spine, and his leg, his symptomatic leg, is off the table. And so when I let pressure off, he's bending his knee and letting his ankle relax. And then when I let the pressure off, he's actively winding up that sciatic nerve by extending his knee and dorsiflexing down into the ground. And we're just going through this on-off cycle. This is a really great technique we teach in our lumbar spine course of a way to manually add in pressure to floss the sciatic nerve for the lower extremity. So it's great for that patient with leg related back pain. But I think this is the one you're talking about.
Yeah, thank you. That's great.
Yep. If you want to groove that one out, definitely get to a lumbar spine course. I'll put that link here as well for you to watch. Good question. And then I'll take question 4 too, because it's related to the same case study from Kaylee. Can you explain your thought process regarding the use of Jefferson curl for a patient who might have radicular symptoms? Yeah, so we addressed this question with this patient back in week 1. This patient didn't really have, true mechanical back pain. He had a 25-year history of being told he should never, ever bend forward again, and that his back is broken, right? And so that Jefferson curl can really encourage that load, can kind of pull that patient into some nice lumbar flexion where they realize, oh, I can bend forward. Like I can bend my back again, right? So that's why we used it with Matt, the patient in this case study. I would not use that if it was actively increasing their radicular symptoms. That would not be the right choice, right? That's obviously somebody who has some flexion intolerant low back pain with radiculopathy. And that might be a person that is a good candidate for some extension work, right? Some McKenzie progression. If flexion is their aggravating factor, we want to try and find out, is extension their alleviating factor? And then the second question, what criteria are you looking at when determining appropriateness for manipulation? I'd like to tell you that I use the CPR, right? But I'm looking and thinking the patient that especially has acute low back pain, especially when they tell me, I feel like if my back would just pop or click or crack, that it would help me a lot. That's a person that I'm definitely saying, okay, lay on your side. I want to try a quick stretch with you. Not to say that I'm not manipulating patients who have a more chronic case, but that definitely that person that's acute, that has some mechanical trauma of like, hey, we did high volume deadlifts yesterday and my back is painful or just super tight, then that's a really good candidate in my mind for manipulation, but definitely acute. I'll still manipulate with leg symptoms. It takes literally 2 seconds to do a lumbar manipulation, right? So crack it, see if it gets better. If it doesn't, that's probably not the treatment for that person. Does that make sense?
Yeah, thank you.
Yep. Mitch, anything to add?
Question.
Mitch cured a guy the other day with lumbar manipulation.
Thursday came in 6 out of 10 back pain, had never been cracked before, hurt his back that weekend, yanking a snowmobile out of the snow, felt a pop, went down. It was bad. It was really bad. I laid in the snow for a while. My buddies picked me up, had to ride in the truck all the way home with back pain. So 6 out of 10 back pain. I couldn't get him until Thursday. Saw him Thursday. Non-radicular, nothing down either glute, nothing down either leg. Could flex forward, just felt a lot of stiffness the whole time, felt a lot of stiffness going into extension. Yeah, laid him on his side and dropped the hammer, sat him up. I said, okay, go ahead and reach down, touch your toes, you know, kind of do that seated thing that you were doing that you could feel your back pain. And he's got this look on his face like, what's going on? And I said, okay, is it still 6 out of 10? He goes, I don't want to say it's not there, but it's barely there. He's like, man, I feel like I can snowmobile this weekend. What do you think? I said, well, yeah, go send it, bud. Came back in for a follow-up today. He's like, I just feel a little tight in my back, but I wouldn't even call it pain. I was like, all right, time to deadlift. Kettlebells out.
It's not always that easy, but it's nice when it is.
I wish it was though, man. I get a text. I'll have to show you this, Alan, that his business partner who sent him into me texted him later that day to, see how it went. He said, how was it? And his response back was like, I just got touched by Jesus. So his buddy sent me the screenshot and sent it over to me. So I think we should put that on our clinic website. Maybe he was just making a comment about my beard. In hindsight, it's probably about my beard.
Both and not or.
Last question here. It's from Todd. For patients with high fear avoidance about their low back pain, do you have a handout or a resource that you give them to dispel some of the common low back pain myths? No, something that we should check out, maybe, possibly. I don't know. I like just having the conversation when it comes up, right? It's like, it's we don't talk about it unless we need to talk about it type of thing, right? So typically we hear about their fear avoidance while we're already having them deadlift. Like we just hammered straight on out into the gym, grabbed the weights, grabbed the bar, whatever, and started lifting. And it wasn't until then maybe that the fear avoidance stuff comes up. And then we usually are dispelling it in real time. Like, listen, like, this movement is not like, I'm going to coach you through it. This is not the reason your back is hurting. It's actually the reason your back is hurting is that we're not doing enough of this movement. And by strengthening your back, you'll increase your threshold and be able to tolerate more and more of this stuff that it comes up in your daily life. And we're going to set you up. If you're having a hard time getting to the bar or the kettlebell, we're going to raise the surface. We're doing all those things to basically get them moving and talk to them while they're moving. So not usually spending time, like reading a handout or sending them home and be like, hey, next time you come back, we're going to lift weights. I want you to think about it. I want you to do some homework. It's usually just like part of what we're going to have them do. Like, hey, this stuff we found really, really helps your low back pain. And if they start to, show inverse symptoms to it, then we'll modify, we'll change stuff and circle back around to it at a later date.
I used to buy like those explain pain patient handbooks, the little ones. And first of all, they never bring them back. So you might as well have $20 that when the patient comes in, you just burn, right? Because you're just going to drop $20 off every visit. But what I found is they don't really go home and read it. We want them to go home and read it and come back with questions. But pretty much that never happens, right? That engineer or computer programmer or whatever is going to do that. But most people are just going to take that book home, just like they do with all the other handouts from every other health provider they interact with, and put them in the junk drawer, right? And so like with this patient in the case study, I am trying to explain my findings of like, look, dude, I don't see anything serious here. I'm not suspecting a fracture. I'm not suspecting a nerve injury or cancer or anything like that. I'm looking at you and seeing you can actually move pretty well. And once we get you moving with some manual therapy, it seems like it cleared up pretty quickly. And actually today we got you bending forward with that kettlebell. I don't see any reason to think that this wouldn't get better very fast, right? Yes, it's been going on for a long period of time, but it doesn't actually seem to be anything serious. I think if we just get your back stronger and get you like in a little bit better shape overall, I think this is going to clear up and you're going to be in a much better position. And there are very few people who are going to say, you know what, I actually don't need to get stronger or in shape. I'm good where I'm at. And this is not the treatment for me, right? Most people are going to be like, oh, actually, those are my goals. Getting stronger and in better shape is one of my goals as a human being. So making them confident, building them up, letting them know with your exam, nothing is really going on. And then show, don't tell, right? Show them you improved 20 or 30 degrees right now. If this was something serious, that wouldn't happen. So there's no reason to believe it won't continue to go this well. Now let's go out to the gym and let's pick up this kettlebell and see how that goes. I find you'll have a lot of success just being direct and honest that way. Okay, I guess we're done talking.
What was I gonna say? That's quick.
I mean, I'm happy to talk more. I just wanted to get this pulled up. Can you guys see this?
Yep.
If you got more questions, let's take them. But otherwise, let's start looking at some deadlifts. And I want to use Coach's Eye, and that's what I've got on here, so I can draw some cool stuff in real time. You guys will be able to see all of that, and we'll talk you through positions, execution, and make sure that we're all squared away here on the deadlift. We're going to start things off with, that's loud. Okay, turn that down. We're going to start things off with a PR deadlift of mine, and then went ahead and PR to PR. So what we're always going to do with your guys' deadlifts is start you in the setup position and say, like, the moment I go to push through the ground, where is my torso angle, and does that change? Now, this is not a pure lateral view, which it stinks. It's cool for an Instagram video. It's not cool for a weightlifting analysis video. I would much rather a pure lateral view so that we can really get a good idea of what's going on with the torso. But if you listen to my PT on Ice podcast this Friday, which I totally know you guys all did, Fitness Athlete Friday. I mean, come on, who wouldn't listen to that? We talked a lot about the deadlift being a push to break the bar off the ground, and then a pull of the hips, right? So watch the leg drive off the ground through this first pull. Yes, it's heavy. It gets me a little bit out of position here, but it's pushing through the ground to get myself in position. And I'd like to see that torso angle be maintained for that first pull. You can see my hips rise up a bit. It's pulling me forward just a tad. It's pulling me that way just a little bit. Positional fault out of my deadlift setup, but I'm able to kind of fight back against this one. What you also see is just a tad of this thoracic rounding going on. Keep note of that, because the next video I'll show you that gets a lot more dramatic, right? So I'm pushing up until the bar gets to my knees, and then when I'm there, then my hips come through to finish this lift. So you'll see the hips come through to finish, and then I got really arrogant in my celebration here at the end because I was super pumped. And sometimes you got to do that, right? You got to throw the belt. You know what I mean? Selly. It's like a bat flip after that's how it felt. Okay. The next video you're going to see, I decided to, hey, why not just jump 15 more pounds? Let's try 515. And what you're going to see out of this video is a lot more change in position, right? So again, well, that's kind of the angle of my torso. Flat to start, but as I'm pulling, let's get that line out of there. As I'm pulling, you're going to see a lot more. You can start to see it, right? The change in back position, it felt like a lot of rounding while I'm doing it in real time. You can start to see the lumbar spine starting to move. Bars taking a long time to break off the ground. If I put it in slow-mo, really slow to get it moving, and then pull my hips through to finish. For me, this was technical max. I don't want to go any higher, because when I went to break the bar off the ground, it started to break me instead, right? It's starting to change my lumbar spine position. It's not moving as fast. Could I have grinded out another rep? Maybe, maybe not. I'm not sure, but I just didn't like the amount of motion that was starting to go on at the lumbar spine when you play it back in slow-mo. So for me, max out, done, made the lift. I'm good. Live to train another day, I'll take it, right? So when we start to see breakdown like that, that's where we're going to pull the plug. Now, let's pull up a couple really technical, sharp deadlifts. I don't know whose video I have here. So if I have your video, please let me know. I don't have names memorized yet, but we're going to look at our setup position. Now, some of you might be saying, hey, the knees are kind of over the bar right there. We're okay with that. What we're going to use as a reference point is the spine of the scap being stacked over the bar, right? So I want the spine of the scap being directly over the bar. That's my reference point, right? Not the acromion. I'm not looking at the point of the shoulder being over the bar. I'm looking at the spine of the scap, okay? So that's kind of our reference point. And it's okay that our knees kind of wind up in that position, because during that first pull, it's actually a push, right? And those knees are going to drive back, and you're going to see this torso angle move up together. So as we lift, boom, look at that. The knees go back. The torso lifts up at the same rate. Boom, looking good. And now it's at the knees. that we can really bring those hips through to finish this off, right? Hips come through to the bar and finish. What I really like about this one is watch how we reverse it and go right back to the ground. Watch the hips go back, boom, and we slide right down the thighs just like we should, right? It should be a direct reversal of finishing my deadlift to going back down to my next rep, right? My hips go back. It's the first thing to go. Oh, there we go. Hips reaching back, and the bar slides down the thighs. I love it. What we see a lot of athletes get in trouble is that they start to bend the knees first. You'll see the knees kind of shoot forward. And when the knees shoot forward, that causes the bar to start to slide forward and gets us out of position and puts a lot of strain on the low back. Okay, so let's be mindful that, hey, when we reverse this deadlift, the hips should be the first thing to break. The hips should release back and the bar should slide right down my thighs. But these are some really solid deadlifts. And the only feedback I really have is, hey, let's put more weight on here, because at this load, back stays flat. We've got a good push through the ground, a good pull with the hips coming to the bar, and a good looking pair of nanos on there, which I know Guillermo respects a bunch, right? Check the watch, see how high my heart rate is after those touch and go deads. Looking good. Okay. Now let's look at what happens if the hips are a little too low. Okay. I believe this is Kaylee's video. Is that right? Okay. So there's our deadlift setup. And if we look at spine of the scap, right, like spine of the scap is kind of around that region there. We're a little bit behind the bar, right? We're just a little bit squatty. Our hips are a little bit low. My cue here would be to bring the hips up 1 inch. But with that being said, let's watch it play out and see what happens. When we set up too low in a deadlift, usually that happens. Set up too low, and the first thing to lift, you saw it in my video a little bit, is that weight starts to pull us. The first thing to go is those hips start to rise up. Boom. So my coaching cue for a lot of athletes is just to start in this position. Bring your hips up in your setup. Let's set you up with this where your spine or your scap is a little bit more directly over the bar anyways, right? That's why we cue that. And then when you get ready to push, you're not getting pulled off balance. Your first push is not pulling you forward. Your first push goes directly up. Everything starts to move straight up from there, right? So if we started you there, boom, look at how your torso just comes right up, straight up. So just a subtle tweak of bringing your hips up to where they naturally get pulled up to anyways. Your heavy lift, it corrects the hips. The body's in a much more advantageous position to lift that bar. So just a subtle tweak, bringing the hips up, and then you'll watch her strong push and then pulling your hips through to the bar. A good finish out of the lift, just a little tweak of getting those hips up, right? Just a little higher. Sweet. Another video of what that looks like. I believe this is Todd's video. Possibly. Yeah, I think so. So I was doing the advanced concepts chat last night. So we had like 20 videos to go through last night. I'm going through a bunch more tonight. Okay, similar kind of thing, right? Butts down a little bit. We've got a little bit of that Allen thoracic spine going on. I've got the same thing going on with mine too, right? But notice what this lumbar spine looks like. Pretty flat down here, right? And so if we can maintain that, I'm in good shape. I'm happy with that. But I do think we're a little squatty with the butt, and we'll see that play out by those hips being the first thing to lift up, right? So we could probably get away with a setup a little closer there as opposed to there, bringing those hips up just an inch. My cue might be to just tighten down on these shoulder blades a little bit harder. If we can't get all of that thoracic flexion out, okay, no problem. But let's cue the shit out of it, right? Let's like squeeze our shoulder blades as tight as we can. Let's pack in the upper back as tight as we can make it, and see if we can hold on to that position throughout the entirety of the lift, right? We don't ever want to get caught into a position where our knees terminally extend, right? Where we shoot them back so far that we're left with like this straight legged and then torso position, because then we're in big trouble. So we're pushing, but we're not trying to terminally extend our knees, right? As we're driving, we want the chest to be in the torso to be coming up. So we never wind up in that position. So we're flirting with it here, but we're still pretty close. We're able to maintain that and finish with our hips coming through to the bar. You've seen those athletes before where they try to push and they basically just straighten their knees all the way out and now their torso's all the way over the bar and they're having a hard time getting their chest back up right over the bar. That's because when they pushed, they didn't drive their chest up. They pushed and their butt shot up and now they're in a bad position, right? They're behind the 8 ball. How are we doing so far? We all right? Let's next look at a very, very, very heavy deadlift. I have no idea how much weight is on this bar. I love the old school iron. I can't tell if we're looking at a couple stacks of 45s, a handful of stack of 35s. I'm just going to assume this is well under over 400 pounds by the way that the bar is bending. It may be well into the 500 number. I'm not exactly sure, but I don't typically analyze a lot of deadlifts from the anterior view, but what you can see from this view is a definite torso change position, right? So look at this position. You can see his chest. And if everything's going well, if we're driving our chest up, I should be able to maintain and see that the whole time on the way up. But what you see is that dumping down of the chest and the head coming forward. So I actually watched this video first and I was like, interesting. Wonder what's going on. Let's go to the lateral view. Let's see exactly what's going on. So it's big weight because he's rocking an Inzer weightlifting belt, which is the serious power lifter's belt. So this is not his first rodeo. You also know he's a serious weightlifter because he's got camo hanging on the wall, which automatically, I'm pretty sure, makes everyone stronger when you got camouflage nearby. But let's check this lift out. Here's torso angle. Look how flat and rigid that is. But here's spine of the scapula. Well, that's trash. Let's undo that one. A little closer, right? So we're packed well behind the bar, right? If we were to draw a vertical line up from the bar, we're like right at the acromion. So we're kind of sitting back into this lift pretty good. And now let's see how that unfolds through this first pull, right? So right away, you can see the change of position we've been talking about. And now we're kind of in this position, but let's get rid of those lines and instead zoom in on what's going on during that first pull. Flat back, push, 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 rounded back, right? So you can see the change in position, the change in lumbar spine shape. For me, this is technical max. This is beyond technical max. We're starting to really get into that compensated position before the bar left the floor. We start moving it. It's moving us a lot more than we're moving it initially, right? And so now we're in a much different position where we're over the bar. Oops, sorry guys. Where we're over the bar now, and I've got a lot of work to do to get my torso back upright. And so what we end up doing is you'll see him scoop the hips under and then try to extend and reuse his quads, because right now his quads are out of the equation, right? He's pushed himself to essentially a straight leg right there. So you'll see as this plays through, scoops his hips back under the bar and then uses his quads to stand it up. Again, a made lift, yes, but you can see how compromised we are in the whole lumbar thoracic spine, that we weren't as compromised here, right? We were really flat and rigid. So little tweaks, again, like we've been talking about. Let's cue the lifter to bring his hips up just an inch. That's going to put his chest over the bar slightly, and that's going to take the setup position from being here to being here. That's it. Subtle 1 inch positional change. And then again, like we've been talking about, I want to see that line as he drives up get maintained so that when the bar is at his knees, it kind of looks like that, right? That would have been a much smoother positional pull than the one that we saw there. Questions on that? It's big weight. It's got to be right near a 1 rep max. If it isn't a new 1 rep max. So we're expecting some positional change. We're expecting some breakdown. That's the kind of breakdown that you want to see. And as a coach to be like, okay, cool, we've had enough. You know, if all of my other lifts prior to that, I could maintain flat spine and that one started to round my back and I was able to finish off the lift, great. Take your PR and then call it a day, right? It's pushing beyond that or making that the standard, making that the habit of how you always deadlift, that becomes the issue. So change position, get them in a better starting position so that we can reduce how much spinal loss of position we're seeing there. Questions, comments?
I think that's good for you all to be able to help athletes as well know that they're probably stronger than they think they are, because it might be a PR, but it's not a true max unless we're right at the edge of tissue capacity. That's literally the definition of a 1 rep max. So when a couple of you said this is a new 3 rep max and you showed 3 super fast deadlifts with no mechanical breakdown, I made a comment like, this is nowhere close to 3 rep max. Like there's more weight on the barbell to be had. So like Mitch said, when you start to see some technical breakdown, you know you're reaching a true max.
I also just realized I had my volume way down. So if I missed people talking, I apologize. I was asking you guys what you thought and I couldn't hear you.
You missed nothing.
I missed nothing.
No.
Okay. This video just makes me sad for the Bills Mafia. I mean, if this is a home gym, this is one of the coolest home gyms I have ever seen. I mean, full paint job, you know, we got the logo in the background. Bills went to the AFC Championship, thought they were going to get it done against the Chiefs. Tables were being broken all across the United States. It was epic. So what's that?
It was a good year. We'll take it.
Good year. Yeah. Patriots didn't make the playoffs. Bills are going to the AFC Championship. How cool. Is this really your home gym, Nicole?
Yeah.
How badass. Okay. Let's move past that. I'm trying to focus. So from the anterior view, really nothing much to see. Sometimes you will see athletes, maybe their knee bails in. You're starting to get an idea of something going on. Maybe they do a little cha-cha with their hips kind of shift into the one side or something like that. But for here, we don't really see any of that. We don't see some big unilateral compromise or anything. So looking really strong from the side. Let's check it out. Set up position per usual. We're going to still frame. Boom, there's the moment of truth. What do you guys think about that starting position? Do we like it? Gotta really love them. And we got to be comfortable, team. Like we've got to be comfortable saying, yeah, there's things there that I like. Like what are my reference points for my setup, right? We talked about the barbell. If we drew a plumb line up from the barbell, that should intersect right around the spine of the scapula. For her, it does, right? Her back is flat the whole time. She does have a bit of some of that cervical hyperextension on board, right? So if you look at the cervical spine relative to the thoracic spine, and then if you extrapolate that out to a standing position, we'd kind of be looking up at the ceiling, right? If we really extrapolated all that out, but her gaze is forward, right? Like so she's looking forward on the wall in front of her. I might just have her bring her attentional focus maybe down just slightly, right? Like not up so much, just down, just to take a little bit of that edge off. That's kind of a cool little feature of Coach's eye. Get rid of that. Okay. Anyways, my answer is yes. I like the setup. I like the start position. You guys should be feeling that. Now let's see how it plays out. If we were in a good start position, you should be able to see that torso line maintained. And she does a really good job of maintaining that torso. I think you're starting to actually pull your chest up a little too early. You're starting to bring that chest up before the bar is even at your knee yet. So I would keep driving, Nicole. I would really keep emphasizing pushing through the floor a little bit longer, and not until here really begin to bring the chest back and the hips through to the bar. But maybe just a tad early on that one. But otherwise, really good start position, really good push through the ground, back stays flat, able to maintain position. Just keep pushing through the ground, keep pushing through them legs to finish out that lift. And again, another sweet pair of nanos. So
I did listen to your podcast on Friday.
Nice.
And with the push, I'm like, I should have pushed more because I think pull, and the light bulb went off. So I have to say,
yeah,
the wisdom there, you know, so I got to
awesome.
push more than pull. So
that's what it looks like, right? Like with the chest coming up, I'm thinking pull. I got to pull myself upright rather than continuing to trust the push and then at the last second pulling them hips through to the bar. really good, and one of the nicest home gyms we've seen. And keep in mind, we've seen a lot of home gyms. I mean, we've seen a lot of videos, a lot of participants. What 30 PTs on average for 21 cohorts. What's the math on that, Fred? 3 times 2 is 6. That's 600 PTs.
Good job on that. Really good job on the math.
That was
That
my
was tough.
COVID plan in case I needed to treat from home. So I do have to move locations this week because my gym is being evicted, but I do not have to treat from home. I'm going to a yoga studio. So
Jim's
Thank
being evicted. Oh man. Oh, part of my heart just broke right there.
no.
Fred, Guillermo, do you guys got anything in specific that you want to see? Keeping in mind these top 2 rows of videos that I have here. I got a couple more I can definitely pull up. We haven't looked at yet, but I just wanted to hit any of that.
I know Josh's video has a very nice, like nice obvious fault. If we want to like have everyone kind of give a shot at that one, especially with the
Is that the
setup.
one Do I
This
have that
isn't
one up
Josh.
now?
No. This is Aaron.
Aaron's.
I could be wrong. Alan, am I right? Am I wrong? Is this Aaron?
I think it's Aaron's.
Yes.
Okay, cool.
This is the one I want to look at because of the setup.
Okay.
Do you have the anterior view too?
Yes, I do.
Okay, perfect.
Ask me how fancy I am. Go split screen on your ass. Okay. What do you see, Fred?
So this is, when we're looking at stance, obviously we want to see a hip width. Folks with mobility might be out at more of their squat stance. And so we have a nice side-by-side here of a sumo deadlift here on the left, which we haven't seen yet, where our hands are inside of our legs. We don't have the interior view of the sumo.
No.
Okay.
These are the only two I saw in the
But
draft.
I can draw while you're on here, right?
You can annotate through Zoom.
Yeah. So I hope you're picking up on this. So first of all, everybody knows that sumo is cheating, but that's okay. We'll look at it anyways. So you'll see. I'm just kidding.
Hey,
You'll
I
see
mi-
sumo.
I missed the first attempt, so I had to cheat.
So sumo is we see a more squatty setup, right? Less of a hinge here at the hip. We see our hands inside of our legs, and we're in more of a squat stance. That lets us pull our trunk up really nice and upright. It's going to let us push more weight off the floor because it is kind of a hybrid between a hinge and a squat. Power lifters, world record deadlifts are sumo deadlifts, right? Because you can use your legs a little bit more and really drive through the floor for a long period of time. So it's cool to see the sumo setup here. That is a good pickup by Mitch there. What we see is we start really deep and then our hips shoot up first. So we do want to be more squatty, but not so much that we just end up with shooting our hips up early. So we could be a little bit more hingy here. This is a great option, probably an underused option of a deadlift for folks that have active back pain, even athletes in the gym. I'm always amazed when it's heavy deadlift day. We just had one like 2 weeks ago. We did 7x3 deadlift of a couple folks throughout the day who came in. I was coaching pretty much all day, who said, my back's kind of bugging me. Okay, we're just going to pull sumo today, right? We're going to go out to squat stance, bring our hands inside, and they're able to do the entire workout sumo without any sort of back symptoms. So it can be a remarkably quick fix. Now on the right here, can you?
Yeah, just check that twerk out. That's impressive, Aaron. You've been working on that, man.
I can't believe those pants didn't split open.
Mine would have totally lost it.
What brand is that?
That's Under Armour golf pants, stretchy. You blow
Okay.
enough
I
pants
used to
out
rock
the gym.
those. Yeah, I know about that. Yeah, putting them to their limit.
The only thing I would say here is that's what it looks like when we're not really tight and strong in our setup and as we're trying to pull with our back. So you see Aaron actually move into more extension from his setup. He's going to pull into extension. That tells me that the athlete is thinking more about pulling than they are pushing. That's usually my tell when I see something like that kind of kind of crinkle up where they're trying to pull with their erectors right there. I know that they're not tight and pushing with their legs because I shouldn't see motion at the back, whether that's into flexion or out. And so then I'll typically just cue a lot more aggressive push. And what I think is really interesting on this video on the left is that we're not getting the drive out of this position. And Aaron corrects on the fly, brings his hips up a little bit, and then is able to get in a position where he can better leverage his leg drive to push through the ground. But that's all I have there, Fred.
It's hard to see from the lateral view. Can you go back down to having it on the floor? But sumo is going to be truly a little bit wider than this and a little bit toed out. And that's really going to help emphasize that push off the floor of that initial push with the quads to be in a much wider toed out stance, probably closer to these AirX pads than a traditional deadlift stance or even this kind of squat stance deadlift, to really create this nice tripod base that Mitch is drawing in for you. And that's really going to help emphasize quad activation to push the floor away in a more upright trunk position. This here on the right, you're getting good with that.
Sorry, I'm having way too much fun.
Here, I would bring the feet in a little bit. First thing in this stance, because we see our hands are right in front of our legs when we push off the floor. And now as we go through and push off the floor in our first pull, we kind of see, if you can pick up on, that's not what I wanted to draw at all. We can kind of see this shift up to the left to clear that bar away from our thigh so that we can actually pull it up our thigh and finish the pull with that deadlift. So I try to either bring our hands out a little bit wider if we can't bring our feet in, but try and emphasize bringing the feet in first so that our hands are outside of our thigh and not in the way of our thigh. So we don't have to do any sort of weird compensation to make sure that our hands don't get in the way of the barbell sliding up our thigh.
So little features like this about Coach's Eye, I just find are really nice, right? Like if you're having a hard time seeing that shift, put a box around it. Can you see the shift now? Right? He's really leaning to that left side of that box on the way up. And so just something that may highlight something for an athlete that's having a hard time seeing it, I think is a nice thing to get used to.
Robert, there's so much stuff on here we don't even use. Like you can do this stuff. What is this?
Stuff.
Keyboard? I don't know.
On Zoom? Are you using the Zoom apps?
He said he loved watching you go John Madden.
And then boom, do you see this right here? This is what I'm talking about. He's gonna zig and he's gonna run the go around and he's gonna hit him with the ball.
Scored a touchdown. Now that's worth 6 points.
Good job, man. Proud of you.
Thanks. Sports.
Brett Favre. I swear to God, Brett Favre, the greatest quarterback ever. All right. That was cool. We saw a little bit of stance, squat stance deadlift, sumo stance deadlift there. Guillermo, you pointed out what video again?
Josh's video.
Josh is the bottom right. He has a really, really nice, nope, that's not it.
No. Okay. Here.
That one. Yep.
Sweet.
He's a really nice clean deadlift. So if his initial setup, whenever the video starts, right there, he gets that set up with hips really nice and low, spine is gap behind, basically like really far behind that bar. His hips never rise up though, which is very interesting. So if you see him start to move up, he does exactly what Mitch just says. His spine angle doesn't change. And he just drives through the floor, stands it up, keeping that bar close to his shins. And I was more impressed because this is a really nice, really strong, clean deadlift without actually having his hips rise up and kind of getting a really strong posterior chain activation. So like we mentioned, ideally you want those hips a little bit higher. You want it to be driving up the ground.
Guillermo's C4?
The one above?
It is just you.
It's just me.
So laterally it looks good, but if you look from the anterior view, I've got a lot of dysfunction going on with that right leg. That gets real wonky.
Let me see if I can pull that up real fast. I just had to close it out because my internet's so slow.
I've got it if you don't.
It's already happening.
Okay. You're getting so good at this. I'm worried about my job security.
That's right, dude.
I've
Back
never
away,
seen you
bro.
use coaches
5 years
either.
later.
Back away. Just got to airdrop it. We're in good shape. Downloads. Here it is. Share, airdrop. It's kind of a process.
I've never seen you use coaches on here. This is pretty impressive.
The best is when you
Is that right?
spend 15 minutes analyzing a video and you go to hit stop and it just freezes and you've just wasted 15 minutes and you try not to throw your phone across the room.
Yo.
Rolls onto that foot.
So I'm pretty sure I've got a congenitally high arch in that right foot.
And do you feel that happening while you're doing it?
I didn't that time.
Does it happen every time?
To be honest with you, I had inguinal hernia repair last June, so it's only been within the past 2 months that I've actually been progressing load up into higher ranges. This was a new 3-rep max for me since post-op.
So are you queuing to push your big toe on the ground? Because right now it looks like your toes are off the ground.
Yeah, I thought I was. Apparently I wasn't.
Yeah, I might just really drill that with a couple like silly little physio drills, like a little TheraBand under the toes or something that if your toes lift up, the TheraBand shoots out. Things like that. Just really hammer down like an aggressive push down to that big toe.
I do
And
like
then
that.
if-
I normally try to do lighter warm-ups barefoot just to get that sensation before I put shoes on also.
Yeah, that's something else that we see a lot of strong lifters do a lot of is some barefoot lifts to get grounded and really well anchored into the ground. Yeah, there's that arch, and then there's a lot more external rotation of that femur too, right? Like we can see that right knee driving out a lot more aggressively.
Yeah, I had a lot of musculoskeletal dysfunction growing up that was never properly addressed until the recent years. And I've had almost no TFL activation on that side with very limited internal rotation. I was getting wrenched into external on that side.
Just been hammering ER, and you got no IR, huh?
So that's just recently been starting to get addressed, and I'm getting more stability within that leg, but I was surprised the trunk stayed as neutral as it did.
The trunk really impressed me, and I picked up on the same thing Guillermo did. Usually when we see folks set up this squatty in the deadlift, that we see what we saw tonight for a lot of us, which was the hips rising up and the torso kind of pulling forward. But in your example, man, like we're able to maintain that thoracic or that torso position throughout that whole first pull, which just tells me, for you, this is a leverage thing, right? This is just using, you figured out what position to be in with your levers, that you're able to drive through the ground really well. It looks like, relatively speaking, it's hard to make an assessment on femur length or tibia length from here, but it ultimately you've just found the position that for you can push through without that chest lifting up. Points of performance are the same, like we've been talking about. It's a push, the torso angle maintains through that to the knee, and then you pull your hips through to finish. It just appears a bit squattier, and this is one where I would have to eat my words, because if you were in the gym and I saw you set up, I'd be like, oh, too squatty, let's bring your butt up. And then you'd show me a lift like that and I'd be like, disregard what I said, you're fine, keep going.
So I think I used to try to set up higher, but with that right leg, I was in a pretty significant lordosis and a hip flexure. I was stuck in like 30 degrees of hip flexion on that right side. So whenever I try to raise my hips higher, it would always put a lot of pressure on my low back when I was growing up and lifting. So I think I naturally went down into that position.
Found a better spot where you could sit into your hips a little bit more. I dig it, man. I've got no corrections to make on it other than trying to get that big toe to pin down from the anterior view.
Appreciate it, gentlemen.
What do we think, team? Are we all right? Have we seen enough deadlifts and broken enough down tonight that you feel like you can make some adjustments in clinic? Is the chat bar going up? I can't see it.
I got a quick question.
Yeah.
toe angle for I have a couple power lifters that do sumo. What are your like? I normally just do the whole 10 and 2, and if they like to go real wide, then it's basically perpendicular. What are your guys' thoughts on how wide and like, do you teach the 10 and 2 if they're a true sumo, or if they're doing the hybrid, do you try to narrow it in a little bit?
Yeah, so let's if we're going wider, I still want to maintain a vertical shin, right? And like, so for me, I need the knee to still be approximated over like the toe. And so if we're going toe out a little bit more, I need to make sure that, oh boy, getting myself into deep water here. If we're going toe out a bit more, oh Christ. Right, here we go. I need to make sure that the toe is in line with the knee, right? So if I go too aggressive toe out and I can't match that with external rotation of my femur, then I'm going to have a collapsed in knee position on a wide toe, right? And so maybe 10 and 2, somebody's got more external rotation. They can go wider than 10 and 2. They can go like 9. They're not going to be able to go 9 and 3, but they may go slightly more than 9 or 10 and 2, right? Like I've seen people with enough femur length and external rotation mobility that and I'm sure you guys have seen this too, where they're literally set out and they have to move their toes out of the way before they drop the bar because they're so wide and they're set up. They're literally almost to the plates because they can externally rotate. That brings their torso almost perfectly upright, and they're still maintaining a vertical shin position at that width. So it really depends on femur length and external rotation mobility for me, for how wide and how toed out someone can get and still maintain a vertical shin. So pushing through a vertical shin for me is important, and then we're adjusting based on preference around that.
Okay. And then with like a conventional, do you ever try to do toe out a little bit, or like even like an 11 and 1 stance?
Yeah, comfort there is also important too. Like Ed Cohn, one of the greatest conventional deadlifters of all time, he would also play around with a little bit of toe out, and he was a really like narrow stance, short, compact, short tibias type lifter, and he would play around with a little bit of a toe out as well. So I think that ultimately boils down to comfort. You're going to see much less variability there with a conventional than you will sumo, where you'll see a lot more variability between lifters. But yeah, there's still nothing wrong with someone's being able to respect that their hips may just have been built different, right? And like Alan, he's just naturally a little bit more toed out even when he's narrow, because of how retroverted his hips are. So I think that's totally applicable, and it really just amounts to comfort at that point.
Okay, thanks.
Yeah, good questions, man. So who is I like to ask this question every time we get to this week. Is anyone not using the deadlift in the clinic and want to discuss like why or what things are keeping you from doing that? Or is there anything that we can do to help ease your your hesitation to utilizing deadlift in clinic with patients?
I know, kind of, if nobody else is speaking up in that regard, I know in a different direction, I work home health outside of running the clinic that I run inside of a CrossFit gym. And I incorporate things like kettlebell deadlifts in with a lot of my neurologic populations and get a lot of significant benefit, especially when training that neutral rib to pelvic position and loading those hamstrings. You get a lot of carryover on a lot of muscles that aren't typically getting load in just your banded resistance style exercises that are actually having pretty significant impacts into the CNS and PNS. It's pretty cool to see. With both stroke, polyneuropathies, as well as a couple of other different, pretty significant with MS as well.
I love it. Heavy loads wake shit up, man. Like,
I've got a personal training client that a coworker of mine works with that I've assisted with a couple of times. She was a 19-year-old stroke, so she's 11 years. She worked with the trainer for about 6 months between COVID and everything. And then I got my hands on her and started guiding the trainer in a direction to go and started progressively loading. When she started personal training 10 and a half years post stroke at 29. She wasn't able to squat down to a 36-inch box, or a 24-inch box, excuse me. She was my partner in a partner CrossFit competition that we do. It's a co-ed competition to raise toys for kids. And she was doing full depth clean and squats and full depth wall balls.
I love that.
Beautiful. That's awesome. You know, Fred, what's the data on the recovery turnaround time for after maxing out? 72 hours?
Mm-hmm.
You know, we always talk about after a heavy squat session or a heavy max out day, the neurologic fatigue that comes about with that, right? Like you may physically not feel thrashed after testing 1 rep max. Maybe you do, maybe you don't. But neurologically, your body is just not firing at all cylinders yet because of how much neurological stress and fatigue comes on with those heavy 1 rep max loads. And to Josh's point, like with your neurologic patients, when you're trying to fire up and awake the CNS and the PNS, like what a really good way to put heavy loads in their hands and have them squat and lift heavy loads if they can, to try to wake up the nervous system the best you can. Alan used to pack up a backpack full of, I'd watch him throw slam balls and kettlebells in there and drive off to the assisted living facility across town and get all, it wasn't Nancy. What was her name?
It was Rosina Manley.
Rosina, get her lifting in the assisted living facility doing thrusters and deadlifts.
Yeah, Chad, we'll talk about that in week 5 when we talk about injury and recovery.
How we doing, team? Any last questions? Y'all ready to enjoy the rest of your Monday night?
I had one question, kind of your guys' opinion on stuff with belts. I noticed everyone uses belts in this, especially with like heavy load. Do you find it a necessity at like these 1 rep maxes, or would you ever like try to train the athlete to just be able to control that?
Definitely don't see it as a necessity. Definitely do see it as an aid. It can help. We like to put that aid in under heavy percentages and loads, where the athlete already knows how to breathe and brace. They already know how to create intra-abdominal pressure naturally, authentically, right? And then they're just basically aiding with the belt to help support that. Whether or not you elect to use a belt and how you breathe and brace into the belt is important. I think we oftentimes see them misapplied with wrong cueing as to what they should be doing with the belt or with utilizing the belt. So making sure that you know how to breathe and brace with the belt is really, really important. Alan, is that belt video, that bracing video still in week 1?
Yep.
So our bracing video in week 1 will really help talk or explain how we describe breathing and bracing, and then the belt is just basically the exact same thing. We're just breathing and pushing out into the belt to help with abdominal stability.
I just had a quick comment. I think going back to using deadlifting in the clinic, my main thing is just trying to become more creative, because I'm in one of those clinics where the heaviest dumbbell we have is 30 pounds. And the heaviest kettlebell we have is 20 pounds. And I still teach people hip hinge and work with those things, and actually have a history of back pain and using deadlift to get through my own issues. But it's hard to kind of get really creative with that when I have no load to apply to people.
That is the most common and the most disheartening comment that we get with these cohorts. For me, it's so sad to hear the number of clinics out there that the heaviest weight they have is 10 or 20 pounds. You would be astonished at the number of clinics that we hear that they are beating their heads against the wall to get more equipment, to get people stronger. I had no idea. I had no idea 2 years ago that this number of clinics don't have access to a respectable amount of weights. We're not talking, clinics need a full powerlifting run of Olympic weights. We're simply saying we don't even have 50 pounds.
Yeah.
we don't have enough weight that, like, you can pack more in your carry-on luggage than what me at the Physical Therapy and Rehabilitation Sports Performance Institute, whatever bullshit name you put on your wall, like, you're not doing it if the heaviest weight you have is 20 pounds. Like, and Alan always breaks down the finances about how logistically easy it would be for these clinics with how much money and revenue you're bringing in to be able to buy a $50 kettlebell. Get me a barbell on sale from Rogue for $199. Get me a run of bumper plates when it's not COVID pricing. Like, it's $500. Like, we're talking less than $1,000 for me to actually be able to do my job and get people stronger. It just, as you can tell, it infuriates me a bit. And I don't know what the solution is. Like, we're going to go on a tear. And every time we do a CFMA, like, we drop into a city, we get a bunch of clinicians from the local clinic. We can oftentimes see change. We oftentimes see those clinics or directors when we talk about, like, what equipment they need. If they're there in the room, they're writing the stuff down because they see it. They see that they need to be doing it. They see the glaring hole that it is. But it would literally take for us to do a clinic, like a CFMA live course for every clinic around the country. And trust me, we plan on doing that. It's going to take a while though. Like, it's going to take a while for us to get around and be like, this is the equipment everyone needs. You guys are well behind the 8 ball. Get it ordered yesterday and get it in your clinics, right? Because you need it. As far as getting creative, they're throwing comments in there. I got off track there, but like the tempo work, pause work, isometric work. How do we make light weights feel really heavy? Get them breathing hard, have them lift the light weights. But ultimately, like, you can make a 30-pound kettlebell get really fatiguing if you make them hold each phase of the deadlift for 10 seconds. Break the floor with the kettlebell and hold it for 10 seconds. Then go to your knee and hold it for another 10 seconds. Then go almost all the way upright for 10 seconds and then lock out and hold for 10 seconds. I mean, you can make that deadlift take almost a full minute to execute one rep, and it's going to feel pretty heavy.
I have a really quick question regarding weights. For me, the space is actually more limited than anything else. But I did get a kind of a functional trainer type machine. I'm assuming, I know I can use a bar and do a deadlift. Any sort of problems with that? Any kind of tips with that? You guys have seen it used successfully or no?
What kind of training machine again?
A functional trainer. It's just basically a high-low machine. It's I'm still at work here. I'll show you right here.
Let's go on a field trip with Chad.
Yes. Oh yeah. So this is my clinic right here. I'm in a 10 by 12 room. So I got this machine here. Okay. It has a nice little bar. I think enough weights to kind of to do some good. But like I said, I mean, I am really limited for space in this. Like, I'm practicing here for like maybe about a month and a half now. But that's all I have space. So I've been using the machine some for that, but I'm assuming there's really no problems with nothing specifically to think about for when I'm doing those deadlifts.
Yeah, no, the thing that comes to mind a bunch is like a cable pull through or something, right? Where they're kind of standing over the cable and they're doing a hip hinge and they're pulling, they're basically they got their back to the machine, cable through their legs. And as they complete their hip hinge standing upright. So like that comes to mind as your easiest option with a machine like that. And then trying to jack a couple kettlebells when you see them come available on the Facebook marketplace. They're always easy to throw in the corner and then pop them out and put them away and you're done. It's much more space appropriate than like a barbell might be for you.
Make kettlebells up to 303 pounds, so they get heavy.
Good question, Chad. Keep us posted on how that's going, man. Team, I want to be respectful. It's 9:19. Thank you guys for sticking with us. Thanks for watching the Coach's Eye thing. Leave us a comment if you like that, if that was helpful for you tonight to be able to see that in real time. Otherwise, take care. Alan, let them know week 4. We're talking press sequence. Guillermo is taking the lead on that next week. So be ready for Gmo behind the mic on the 1-2, 1-2s. We also got midterms that are due. Alan's going to tell you that right now, when to get those submitted by.
Yep. The movement this week is the press. We want to see both your strict press and your push press. So we want to see strict, no leg involvement, and then push press using your legs. Both those videos are on the website. And then this week, by next Monday night at 7:59 Eastern, your midterms are due. It's like 20 questions. It's super easy. It's not the NPTE, right? You can all do it, right? It should take you about 20 minutes. So don't think about it too hard. If you've been keeping up with the lecture material, it should be quite a breeze. Should be straightforward from the lecture and straightforward from the movement videos, the points of performance. So make sure you make time to get that done. If you don't get that done, you can't pass the class. So make sure you have that on your schedule to get done over the next week.
Team,
Folder.
have a fantastic night.
Posting a folder for everybody, guys. Just everybody post their video into that folder. Don't create a folder, just all videos, same folder, one spot.
Put it in the folder, the one folder.
Everybody
One
loves
folder.
folders in this group, creating folders and folders.
Everyone's making a folder in a folder.
All right, bye everybody. Have a great week.